Tonight in Medical Rounds, chronic pain can be unbearable, especially when you've tried everything with no luck. Now there's a newer treatment option available at the Hartford Hospital Pain Treatment Center. It's called the spinal cord stimulator. Dr. Ricardo Taboada is an anesthesiologist specializing in pain management. Good evening, doctor. Thank you very much for being here with us.
Good evening. Thank you for having me.
You know, first, tell us what type of chronic pain we're actually talking about here.
So there's different types of chronic pain. You can have something called somatic pain, which is, for example, if you bump your hand on a door. But there's also a type of pain called neuropathic pain, which is essentially nerve pain. Nerve pain can be described as a burning, tingling sensation, obviously accompanied by prickling sensations. Often happens in patients with diabetes or a type of nerve injury that can occur from surgery or any other issue. And you'll see it a lot in the hands and feet.
So we mentioned spinal cord stimulation. It sounds interesting. Tell us a little more about how that works to minimize pain.
So spinal cord stimulation is a type of therapy that we use once a patient has failed all types of conservative therapy treatments. And what we do is we install some little leads, they're little cables that we put into the spine, not actually into the spinal cord, but near it. And we use a little bit of electrical current to stimulate the spinal cord. What it does is it blocks the nerve impulses from reaching the brain, or it actually replaces the sensation of pain with a more comfortable sensation, and most recently with the newer technologies with absolutely no sensation at all.
Who is actually a good type of candidate for this kind of therapy?
So like we mentioned before, any patient that has failed more conservative treatment options and is also not on an extreme amount of opioids, they could be good candidates if they have neuropathic pain. Patients with diabetic peripheral neuropathy, patients that might have phantom limb pain. There's a few diagnoses that actually work quite well with this treatment, which is post-laminectomy syndrome, any pain that's developed after a spine surgery or a pain that was there previous to the surgery that hasn't been resolved. In addition, there's complex regional pain syndrome, or RSD as it's sometimes known, which is a very complex type of pain syndrome, but it can be very, very debilitating.
Well, it's certainly nice to know, and I know not a lot of people will be relieved to know that there are options. You don't have to just live with this.
Absolutely. We have various options now, and in recent years there's been a lot of development in the type of technology that we have for this method of treatment. And we're very excited to see what the future holds for spinal cord stimulation as well.
All right, Dr. Taboada, thank you very much for sharing this fascinating treatment information with us that certainly will help a lot of people. There is